Good morning, everyone. It is exactly 8 a.m. I just asked you to bear with us for 2 minutes. We're just going to give some more people time to join in case they ran into traffic on the way to their dining rooms. So just we'll talk to you in just 2 minutes. Thanks. Okay, we are going to get started. Good morning, everybody. My name is Scott Appnell, spelled Appnel, and I ask you that, or I tell you that, for selecting me from the chat purposes as we go along. I want to welcome everyone to our virtual safety peer group presentation. There are about 200 people registered for today's webinar, so I want a lot of new faces. uh, pun intended, of course, with faces, but the just a quick intro on what safety peer group is for those first timers. This is something we've been doing 10 plus years through occupational medicine at Lehigh Valley Health Network. It is an OSHA Alliance program, which means we have a formal agreement with OSHA to provide education to the business community. We generally do these quarterly. We do them in person with WebEx availability. We are doing this a little sooner. This is a special presentation just because of a lot of the questions and information out there. We thought this would be good to get something going here. So welcome and thank you for all who joined us. By the way, we select the name Safety Peer Group because the idea is that this is a group of peers sharing information, be it as presentations or questions or anecdotes as they come up. The idea is we all are learning from each other. Just a quick couple housekeeping things on the presentation. When you joined, your microphone should have been muted. If not, I see some aren't. If you could please mute that with as many people. If there's any ambient noise, it'll be a distraction. Video, I believe it with the default was to shut off. Feel free to join in video if you'd like. Uh, but you can keep an eye on that. If you wanted, any of the controls are across the bottom of your screen if you're not familiar with WebEx. The one I want to bring your attention to is right in the center. There's a blue circle that has kind of a cartoon bubble. That's for the chat. I would ask you to open that, and then you'll see it on the right side of the screen. If you have questions as the presentation goes, please select me from the list, again, Scott Appnell, and send me a note in the chat. Now, if you have a question that you want me to ask, just write out your question. If you would like to ask the question yourself, just include your name because I can't see actual names on some of you, but include your actual name and just say, I have a question, and then I will cue you up to the speakers, and then you can unmute your mic and ask the question yourself. Just note, when you get to the chat window, the default is everyone. So, I mean, you can chat to everybody, but you could just select me if you just want something to go right to me. And I think that's what I had for the housekeeping. The format of the presentation is Dr. Carmine Pelosi will be going first, followed by Attorney Keely Collins. I'll do a quick intro for each of those when it's their time. And the presentation portion has been kept a little on the shorter side to leave as much time as possible for question and answer. We do have this listed as going to 9. We're not going to cut it off right at 9. As long as our presenters can hang online, we'll continue to take as many questions as we can, since there seems to be a lot of these days. Those of you who sent in questions in advance, I have those, and we will answer them as we at the end at the Q&A. I do also want to make a plug. Scott Shamandel from OSHA is, as always, in attendance. So I know I had at least one question that was OSHA directed. Just want to let everyone else know. He is the compliance assistance specialist. Great source of information. He's there to help everyone navigate the wonderful world of OSHA. So if you have questions for him, please send those as well, and we'll cue Scott up to answer those. Okay, without me rambling anymore, because that's not what you tuned in for, I'd like to introduce Dr. Carmine Pelosi. He has several titles at Lehigh Valley Health Network. He's Chief of Occupational Medicine. He's also the Executive Director of HealthWorks, which is the Lehigh Valley clinics for occupational medicine. In addition to that, he is also a practicing doctor. He works 2 days a week, the mornings at Lehigh Valley Health Network's Employee Health Office, where he is seeing patients regularly. So he does have that clinical experience to share with us. He has been actively involved since the COVID pandemic started. In addition to consulting with local, national, international companies on their policy, he's also been actively involved in return to work with patients, LVHN employees, determine when it's safe for them to get back in post-COVID. So with that, over to you, Dr. Pelosi.
Thank you, Scott. Can you hear me pretty well right now? Okay, great. Well, thank you for allowing me to speak with you all today, and I hope you're all doing as well as can be expected in these challenging times. When I was preparing this topic, which is really back to work and medical policies, and obviously some of you are in life-sustaining businesses already, and I've been talking with some of you about your challenges with COVID-19. But as I was preparing this, I had difficulty keeping the discussion to a certain time limit. So what I'm going to try to do is I'll go really quickly through some of the slides, and I'll spend more time on some others. So if there are questions later, I'll be happy to answer them. Hopefully, you'll forgive me for going through some things really quickly, but that is to conserve time for your questions also. So let me start with the first slide here. And this is just a reminder that we have lots of data available. We have data. I have it within my own health network of Lehigh Valley Health Network's testing of COVID-19. And what you're seeing here is a chart that's available to the public about testing throughout the counties served by Lehigh Valley Hospital. And this tells me how many tests are being done diagnostically and what the positive rates are for those tests. And there's a number of reasons that there's more tests than positive tests. But I won't get into the discussion about that now. This is just a reminder that there's lots of data regionally, which might be important to you. If you have a plant in a local area, you can see what's happening in that area where your employees are coming from. So next slide, please. Just some more data. This actually shows some positive, hopeful trending that we're seeing in our health network. We had plateaued somewhere around 200 inpatients with COVID-19, and it seems that we're on a bit of a downswing now. And this data is as of 5/4, it's now 5/7. As you can imagine, every day is a different story with data, and every day we're finding new information. So, but this is at least a positive trend for our region. Now, keep in mind that there are certain areas of the state that have less infection rates, like the Schuylkill area. Then there's areas that have a higher rate, which are the areas closer to the New York, New Jersey areas. So it really is regionally, regions really do affect the rates that we're seeing. Next slide, please. Just another slide that shows testing rates and positive rates. I want to bring your attention to other data sets that might be really important as you get back to work, and those are the Johns Hopkins coronavirus site, the Department of Health, the Pennsylvania Department of Health, a site which lists rates and numbers of infected individuals by county and so forth. Next slide, please. So originally, we felt that COVID-19 was indicated by some major symptom patterns. Dry cough, shortness of breath, and fever were the three main symptoms that initially, when we're starting to see people, if they had any of those symptoms, we would test them. And because testing was not readily available, we would try to limit those that we did not feel had those symptoms or did not seem like COVID-19. Now we know that, and I've compiled this list based upon the dozens of people I've seen now with COVID-19 and as they were recovering, that the symptoms are much broader in scope. And I have had many people come in without having a fever, but they've had other symptoms, GI symptoms, headache, some with dizziness. A lot of them have had loss or diminished sense of taste and smell, some of them as the first indicator. So if we're getting into screening for workplaces or questions to people about their illness, I always ask what their symptoms are, and it may not be the cough or the fever. It may be one of these others that I've listed here. Now, CDC has their own list of symptoms on their website, and what I've indicated on this slide is what is a CDC major criteria of symptom and also minor symptoms that they consider, but clearly beyond what we originally thought. Next slide, please. So to spend a little time on this slide, and you will hopefully all get these slides, so I won't read it word for word, but when we're considering releasing people from isolation at home or allowing them to go back into a workplace, for instance, let's say they're working in an essential business, before they would go back to work after they have COVID-19, and this has changed within the last 48 hours. So if you're seeing this news, some of this information, keep in mind that this will change very rapidly as we get more and more experience with recovering individuals. So we give them now 10 days after their first symptoms appeared for COVID-19. We used to say 7 days. Now we've extended it very recently to 10 days. We don't want them to have any fever for 72 hours, and we want them to be without symptoms or resolution of symptoms for at least 3 days also. We used to say that the symptoms would need to be improved or improved greatly, but now we're saying resolution of symptoms. And I've had a number of individuals who didn't feel like they were short of breath, but I've had them walk up and down a hallway, for instance, and then when they sit down, I notice that they still have residual shortness of breath. Or if they're sitting there, I'll have them take a few deep breaths, and they haven't been coughing, but then taking the deep breaths is enough of an irritation that they'll cough. So those are signs to me and some of the indicators that they're still in a recovery phase. One of the special cases that we have are for hospitalized patients. If they've been hospitalized, that usually it means that they've had a severe case of COVID-19, and we wait 7 days instead of after resolution of symptoms, as opposed to 3 days after resolution of symptoms. If they have any lingering fatigue that's significant, even though they might not be infectious, remember that they're still recovering. They may not be ready to return to certain jobs. So that is also a consideration. And many times people will not be able to get a note from their treating practitioner just due to the volume in the clinics and offices of COVID-19 and other cases. So there's times when we're not able to get a note. We have to work around that. So next slide, please. In general, when individuals return to work, we request that their temperature be taken before every shift, that they're wearing a mask, and there's other precautions that are used, and these are well laid out in documents. I won't go into them in detail. I would suggest to you one of the documents that you'd really like to have in the workplace or to assist your workplace is the guidance on preparing workplaces for COVID-19, which is available through osha.gov. Just do a search for guidance on preparing workplaces for COVID-19. I think it has a lot of good information that you can adapt to your workplace. A lot of this information I've listed on the slide is in there. One of the other things I want to add is hydration is really important as individuals come back into the workplace. Use protective equipment, and especially if they've been recovering from COVID-19. There have been a lot of questions that I've received about return to work issues. It's advisable that you do have a medical consultant to assist with some of the return to work issues as it applies medically. Questions come up about many different situations, and if you are just starting to look at return to work, having a medical consultant is really important, or a medical director. Next slide, please. So I won't spend a lot of time going over this. This is really a distillation of the Secretary of Health's order, which was put in place at the end of April or near the end of April. And I have the website so that you can look at that order. If you have not seen it, I strongly suggest you download that, look at it. It has a lot of information, and the order specifies certain activities at your workplace that you need to follow. What I've done is taken the 5-page order and I distilled that down into 3 slides here, and I won't go through them. But what I've also done is where the order lists referring to the CDC for further information, I put links in there so that you can take that information and just click on the link, or to copy and paste it into your browser and go right to the CDC area where you can get further information without having to do searches. I find that trying to do searches for information in a number of these sites leads you to all sorts of down different roads where you spend a lot of time searching. So I was hoping this would be helpful to you as you go through some of the information about sanitizing work and distancing and other precautions that are listed in the order. So I'll go through the next 2 slides also, which are part of that order. Let's go to the next slide. And I won't read from this except to once again say that there's links in here, or other referring areas where you can get information, which I think will be helpful to you. Next slide. And once again, from the order. So the order would be really important for you to download from the Secretary of Health and go through. But I did kind of highlight in these 3 slides all the information on there. And the next slide. So I want to spend about the most of my time on pitfalls, observations, and advice, hopefully to make it a little more practical. If you're in essential business, or if you're just considering getting back to work. When to start back to work, of course, is driven by regulation. It's regional. It has to do with the data, the number of the rates of infection. Are we looking at a certain rate of infection per 100,000 over a 14-day period? They use that data in some of the models. In Pennsylvania, the governor's office is using Carnegie Mellon University to provide some of that background for which is driving the decisions for return to work, in addition to healthcare resources in an area, the ability to contact trace. So there's a number of things that go into decisions to return to work. And I would just say, consider the risk in your own business once the orders, or once the phase goes to yellow, or if you're in essential business, just consider the risks and how you might decrease them in your own workplace. Consider decreasing risk by initially limiting maybe groups that are working in your facilities. Those who are 65 and older are higher risk. So you may give them a pass for coming in perhaps for the first a few weeks or month just to reduce their risk. And obviously those with underlying medical conditions, not that I would advise you discussing any of those with your employees, but just I've listed some here which would be concerning and higher risk for those for risk of infection. So if somebody does have an underlying condition such as those listed here, they are at higher risk, and it may be a good idea to limit those groups and have them have the ability not to get back to work initially. Of course, I would strongly advise legal review of anything that you're doing and ensuring that you're not sharing confidential information. If somebody says to you, I don't want to get into work, you don't want to discuss their medical issues with them. Another thing that I found is individuals may have some unusual or minor symptoms, including the worried well. I mean, I've had people who were taking their temperatures every day because they were fearful of getting COVID-19. I've had other people who have minor headaches, but they get them all the time, or a sore throat with allergies. So there are going to be a significant amount of people who have some minor symptoms or concerns. They don't necessarily have COVID-19, but of course it can be difficult sometimes. And I would suggest a potential screening program as people go back into the workplace. So taking temperatures is one way to do that, but symptoms, and I know when I go into the hospital, I get my temperature taken, and the nurse will ask, how are you doing today? And my response better be, I'm doing good, because if I say, I'm not feeling so well, I wouldn't get past that screening person. And there are lots of different tools to screen that might be available, and even some of them electronically. The next slide, please.
Dr. Pelosi, if I could just quick, it's Scott again, and just quick jump in. I failed at the beginning to just confirm with everyone. This is being recorded, and you will get a copy of the slides emailed to you, as well as a link to the recording on YouTube. That'll be out the next day or two. But a lot of people are asking because there is a lot of information here. So, you know, if you're not taking screen captures or writing really fast, don't worry about it. You will get it. Thank you. Sorry.
All right. Thanks for interjecting that, Scott. I do appreciate it. There are a number of percent of people that walk around with COVID-19 and they are asymptomatic, meaning they don't have any symptoms of it. Is it 5% of the population? Is it more? We don't really know. But my key point here would be, obviously, if people are coming to work and they don't have any symptoms, but you don't know, and they may not even know if they have an infection, what we want to do is to practice standard precautions. And those standard precautions are sanitizing, distancing, wearing PPE properly. And we do this in healthcare all the time. We practice standard precautions because we never know who is going to be infected. We don't know what conditions they may have as we're evaluating them. And this is what we use in healthcare to help protect us and others that we take care of. Same thing would apply in the workplace now. Next item, mask, goggles, PPE are subject to inappropriate, go back one, thank you. Mask, goggles, and PPE are subject to inappropriate wear, use, and contamination, requires high vigilance and corrective action. You know, I see people frequently touching their masks, touching surfaces, adjusting their glasses, touching their face. It's just normal human behavior that we touch our face and we touch other things, and that's one of the issues that, or the problems that may cause a lot of contamination now is the hand-to-face touching. So people shouldn't be wearing masks under their nose. I see that sometimes. They should be wearing it and hopefully sealing around their nose and mouth as best possible so that droplets are not escaping from around the mask. Remember the Safety 101 hierarchy of controls. I tried to make COVID-19 fit into the hierarchy of controls. And if you don't remember that or haven't heard of it, NIOSH has great diagrams on that. But you know, if you remember, PPE was one of the areas that we look at as maybe less effective than other controls in a hazardous environment. And I would urge you to look at the hierarchy of controls and see what it's like if you try to fit. It doesn't work perfectly here, but if an infected individual is the risk, then how do you control that risk? And you may be able to make it work, at least it may be a framework to think about how to control the risk in your workplace. An N95 with an exhalation valve. Remember that the N95, for people who have to wear N95s, they filter the air coming in. But if they have a valve on them, there's no filter on that valve for the air going out. So it's something that if you have to wear it in a workplace area, I would wear a surgical mask or face covering over it to control droplet spread. I have seen a number of cases now and been talked to about a number of cases where people cannot wear a face mask. And I'm not just talking about a respirator or an N95, I'm talking about like a surgical mask. Some people even have problem with materials. And I've had to try to substitute with a different type of mask. That has been unsuccessful sometimes. And I've had to then suggest that a person wear either a cotton or paper lining under a surgical mask. And I've been pretty successful with having people wear some type of a cotton lining under the mask, as long as the mask isn't touching the skin. But I do have a few cases where I've had to move on to suggesting that they wear PAPRs. And those were people who needed to wear N95s. Obviously, PAPRs may be limited in supply, so we don't like to generally recommend them unless we have to. But sometimes people do have very sensitive skin. You need to have a plan or a medical consultant that you could talk to about that. Next slide, please. Lack of doctor's note. I mentioned that quickly before. Even the CDC has mentioned this in their guidance with the amount of volume that we're seeing. You may not get a doctor's note when someone is ready to come back to work. That's where maybe screening is really helpful. Taking temperatures, maybe have someone confidentially asking how a person's doing before they come into work. But you may not always get a doctor's note. So be prepared if someone's trying to get back to work after being ill and how you plan to get them back in. Issues of HIPAA violation and confidentiality. This is an area I'm concerned about because it'd be very easy to ask people, how are you doing? How are you feeling? Especially if you knew that they were home with COVID-19. And you really don't want to get into those issues, medical issues. People may be very willing to say, hey, it was terrible because I have underlying heart disease. I have this condition, that condition, and you don't want to be discussing confidential medical information. So I would just caution that this is a time when you can't let your guard down with a lot of different risk strategies, and one of them is to really be careful with confidential information. Testing, the issue with testing obviously comes up all the time. There are two types of tests. One is the diagnostic test. That's what we're doing when we're trying to diagnose a person with COVID-19. That's the one where we take the swab and we check, we use that swab, and then we do a check to see if the person has the virus. That's called a virus or a PCR test, a polymerase chain reaction test. And that will tell you if they currently have the virus. It will not tell you how infectious they are. There might be times when they have the virus and they're not infectious in the recovery phase. There may be times when they're tested too early in the condition where it could be a false negative. I've seen that happen a few times. But overall, that is the test, that's the diagnostic test. So when somebody says that testing is offered, it's really important to know, well, what testing are you talking about? Is it the diagnostic testing, or is it the number 2 on this slide, the serological immunity testing? That's the test that we're now using to see if the person has had COVID-19 and they have antibodies or neutralizing antibodies to it. It's an IgG test that we're using, at least. There have been some others for research and others used in other countries. This is an immunoglobulin G test, and it's generally positive about 14 days after the onset of symptoms. You have to give it a little time for the body to react. And this is what we're looking at to see if we can get a test done to show that somebody may be immune if they're brought back into work in a high-risk situation. If they're already immune, obviously they won't be able to get the virus again. The problem is that we don't know how long immunity will last. We don't know if the test is a false positive test for immunity because the test may not be sensitive or specific or give you a positive prediction enough.
I'm going to get out of another meeting. I'm just going to.
Morning.
So you want to right now, since we're just starting this testing, there'll be more developments on that, and there'll be more information forthcoming. But we're using this now. We're starting to use this now. Next slide, please. Hand sanitation reinforcement. Just make it easy for people to sanitize their hands. Pay attention to ventilation. Ventilating areas reduces exposure to viruses. It also keeps people cooler. I've already heard complaints about wearing masks and heat buildup in areas. Be careful in high-risk areas, areas where people may get together in groups and remove their masks, like to eat. Obviously, maintain distancing, maybe using barriers. There's a great picture of a Hong Kong diner where they put clear barriers on the tables while people are eating to prevent viruses spreading through airborne transmission. Staggered use, boost hydration in the workplace. Once again, avoid discussion of personal medical information, and it's really helpful to have a medical consultant or a medical director make the arrangement before you start running into problems, is my advice. Next slide, please. So one of the other things that have developed through this time is video visits or phone visits for uncomplicated workers' comp care. If a person doesn't have to come into a medical facility and it's an uncomplicated issue, I would consider allowing employees to use video visits if it's uncomplicated. It might be a follow-up visit for an injury. These have been working really well. I would explore the options. There may be some people who are older or have underlying conditions. They don't want to go to a medical facility. Although we attempt to keep them as safe as possible, it's another option. And it's very convenient for people also. One of the other things that has been occurring is stress, mental stress during this time. People's lives are upended. Their schedules have changed, very stressful. So if you haven't talked with your EAP program, or if you don't have resources, I've listed one of our resources here, but they've been very important as we've had to deal with COVID-19. And it would be good if you had a plan in place for others who are very stressed out about all this. Next slide, please. Just some other resources. This is an association. I'm a fellow of the American College of Occupational Environmental Medicine. This is a statement that they put out. I won't go through it, but there's some information here and some resources online also through them. And next slide, please. Some other helpful or important resources I've listed here with websites. So I would suggest that you look through some of these also. And next slide. And so with that, being cognizant of the time constraints, I'm going to turn this over to our excellent attorney speaker, Keely Collins, who I've worked with over the past few years. She has been excellent with business, legal issues, and so forth. So, Keely, without further ado, are you available?
Yes, can you hear me?
Yes, we hear you well. Thank you.
Good morning, everyone. I'm so delighted to be here with you today, and am honored and humbled to be presenting with one of our heroes, LVHN, in the fight against COVID-19, because at this time, medical precautions are legal risk management. I could just simply defer to Dr. Pelosi's presentation, but in terms of specific policies to legal risk management, from the legal perspective, policy is where corporate culture meets legal risk management. On one hand, for all policy development, it is critical to continue to defer to your corporate culture, which are your core values and your mission. That is what does not change. That's what pulled the Lehigh Valley out of the recession. That's what will pull us out of this. Your corporate culture continues to be a centerpiece in your policy development. But secondly, whenever you're developing policies, it's crucial to consider legal risk management. The standards from legal risk management have changed. And may also over time impact the corporate culture and the decisions you make. Whenever you're revising policy, there are three different categories, three general categories your policy changes fall into from a legal perspective. The first category is the changes you must make. So you have to make these particular policy changes for legal compliance. Secondly, changes you should make or may want to consider making for best practice purposes. These are changes that aren't necessarily required by any kind of law. However, they help in minimizing legal risk management to the extent that they fit within your overall corporate culture. Thirdly, changes that you may make if you want. So these are changes that the law allows you to make that perhaps you from a corporate perspective would like to make, but aren't necessarily requirements or necessarily a legal best practice per se. There are items that you can do. Throughout my portion of the presentation, which I'll try to keep brief, I will be referring to the changes that you need to make, the changes you may want to consider for best practices, and then finally the changes you may make if you so desire. Next slide, please. At this time, you may have noticed, and that's why you've taken the time to be here today. Your time is precious, and we appreciate your time this morning. There are ways that legal risk management has literally been turned upside down. The advice that we lawyers have been giving you now, to some extent, is either obsolete or temporarily unnecessary. And there are three main ways that I would like to highlight with you that legal risk management has essentially been turned on its head. Next slide, please. One of the first ways, and perhaps primary ways, that legal risk management is essentially upside down at this time is employee absenteeism. In the past, it has been my pleasure to do presentations like this for employers and HR leaders, just like all of you, on limiting the abuse of employee absenteeism. You all remember that from 3 months ago, right? Trying to minimize the risk of employees' abuse of your leave policies. The general prevailing wisdom from your employment attorneys has been to try to limit the risk of employees abusing leave time by closely monitoring their use of PTO and by enforcing policies such as perhaps an FMLA policy that requires employees to complete the FMLA paperwork if they're going to be absent for 4 or more days and so forth. Those types of policies to limit the risk of absence abuse. Now, in the COVID-19 era, as I believe Dr. Pelosi's presentation gave some evidence for, is that the main risk has changed. Yes, if you are an essential business and you're open for service, you need to get employees in there. If you're requiring remote work, employees need to be logged on and performing the functions of their position. However, the main risk at this time is not so much the abuse of PTO. The main risk is limiting transmission in your workplace. There are several areas that employers might want to actually encourage employees to quarantine and to limit the risk of their exposure to the office, as opposed to being so strict on the PTO policy. First of all, just general workers' compensation risk management. There is actually a provision of the workers' compensation law which may allow for claims to be made against the organization if the employee can establish that they have contracted COVID-19 in the workplace. Now, you may be saying, well, how could they establish that? There are all kinds of places that they could come in contact with COVID-19. We're still under a stay-at-home order, so if you have an essential business and the employee is they can make the claim that the only place they're really going is to work. We're actually living in a time now where it could be possible for an employee to make a successful claim of a workers' compensation injury or illness based on contracting COVID-19 that they were exposed to in the workplace. There are also other actions, such as survivor actions, that could be taken against the employer, as well as OSHA safety standards that are of critical importance right now, and much more important, arguably, than enforcing an absenteeism or attendance policy. And going back to my original promise to point out to you the changes that needed to be made versus the changes that you just may want to consider. There are some employers, to minimize the risk of transmission in the workplace, who have actually been putting a sort of moratorium on their PTO policy, meaning that employees are encouraged to take leave from work without having to use PTO under the typical PTO policy. Again, that's not required. That is a change that some employers are making in order to encourage employees not to come into the workplace. So that's a possible change, not a required change. A required change, on the other hand, is under the Families First Coronavirus Response Act. There are mandated leaves of absence. And probably many of you have already contacted legal counsel to explain this, but just to make you aware of the potential issue, there are two types of leaves that are legally required that were not required before. One is an 80-hour, 2-week paid emergency sick leave absence, which is for a variety of COVID-19 reasons, including childcare and the employee's own COVID-19 symptoms, as well as care for a family member that an employee may have to do who is under quarantine. The other type of expanded leave is an expansion of the FMLA to require leave for COVID-19 childcare reasons. So that could be an entire presentation in and of itself, but just to be aware of the issue that may factor into your policy making post COVID-19. Next slide. The second legal risk management area that's been essentially turned on its head is medical assessments. Generally, we employment attorneys usually will instruct employers to just completely avoid medical assessments altogether, exercising extreme caution in sending employees home who are sick, and strictly requiring documented proof of doctor's orders. That's just the normal prevailing wisdom. As Dr. Pelosi indicated, we still are in a time when confidentiality remains important. So it's not as if we're just throwing out the old rule book entirely. However, there are different legal risk management concerns now with respect to medical assessment in the COVID-19 era. First of all, temperature screening is encouraged and sometimes mandatory. Going back to the 3 categories of policy, that which is required, that which may be best practice, and that which you could do if you wanted to. For temperature screening, if you do not have an actual or probable case of COVID-19 in the workplace, there's no legal requirement that you do temperature screening. However, in certain workplaces, due to perhaps the proximity of workers close to each other, the proximity of workers to your clients or your customers, or other types of issues that may come up in the workplace, it may be prudent for the employer to implement some type of temperature screening prior to entering the workplace. You heard of Dr. Pelosi's story entering the hospital. A hospital is a place where there would be many actual or probable confirmed cases. So perhaps that's not the best example, but there are plenty of employers who have not experienced a case and are still conducting temperature screenings because it's prudent in their workplace environment. So that's an area that may not be required, but could be helpful. Secondly, employees who appear ill may be sent home now. That's different from the prevailing risk management advice of completely staying out of an employee's medical situation. We had guidance or advice recently released by the Equal Employment Opportunity Commission, EEOC, the agency that oversees the enforcement of the Americans with Disabilities Act. That specifically provided that employers are encouraged and able to send employees home who appear to have symptoms or appear ill. And then finally, flexibility to the extent necessary with documentation. I have had some clients who have had good luck in having employees provide an actual physician certification from the treating physician. So we have had some luck with that with some certain clients, but then others that are in perhaps more populated areas have been reporting to me as their attorney that they've been having some difficulty in obtaining this documentation. Consistent with Dr. Pelosi's advice earlier and also with the EEOC guidelines, we've been recommending that employers have some level of flexibility with this documentation because it's possible an employee might physically not be able to get it or not be able to get it at this time. So as you can see, for your policy development and bringing employees back, there are some differences in the prevailing wisdom and the COVID-19 wisdom at this time with respect to medical assessments. Next slide. Employer control over the physical presence of the workspace. Normally, it is, and still to this day, certainly within the employer's purview to direct and control employees' physical presence in the workplace. Employers absolutely have the discretion to compel employees into work unless there's some type of contract or collective bargaining agreement that provides certain restrictions on the employer's ability to control the physical presence of the workspace. And certainly the prevailing wisdom is that an employee's failure to report is insubordination, which could result in termination. Now, in a COVID-19 workplace, it is more prudent, perhaps, for the employer to have some level of flexibility when opening the business up for employees' physical presence. I recommend to employers to divide employees into 3 general classifications when they resist reporting. So if you have an employee who resists reporting, I have a suggestion for you as to 3 general classifications. The first classification is employees who are resisting reporting who may have a legally protected reason for being entitled to leave. And the leave here is generally under the Families First Coronavirus Response Act, which requires employers to provide leave for certain COVID-19 qualifying reasons, which could be childcare, because the employee's child's school is closed or the employee's daycare is closed. So first of all, you have one grouping of employees who are resisting reporting, and they actually may have a legally protected entitlement to leave time. The second category is your high-risk employees. So you may have an employee who's resisting coming into work because he or she has an underlying health condition such as asthma or a heart disease or even obesity or some other reason that would make this individual more susceptible to COVID-19. For that category of employees, there's nothing necessarily prohibiting you from a legal perspective, as in there's no specific law that you would necessarily be violating. But for those employees, for other legal risk management reasons, you may want to consider allowing some type of reasonable release of that employee from the physical workspace. Remember earlier in the presentation I alluded to, there are other areas of law that require that provide very good reason for employers to exercise a standard of reasonable care in the workplace. So this second category of employees, you're making some concessions because you're considering risk under workers' compensation law, you're considering risk under other types of tort actions such as survivor actions and so forth that could be brought against the employer for failing to act reasonably. So that second category is purely within your discretion, but I would advise you to think of legal risk management reasons in making that final determination. The third category, these are the employees who just are insubordinate. These are the employees who might be young and healthy, and their spouse or their partner or their roommate or apartment mate just happens to be home from work and they want to be home with that person or something, or there are all kinds of reasons why someone might resist coming to work. It could be one of your frequent offenders who, even under normal circumstances, resist reporting to work anyway. In that third category, generally speaking, you would follow your normal policies and whatever your, going back to corporate culture, whatever your company feels is appropriate in terms of handling that third category of employees. In certain cases, you can proceed with termination, but the prevailing wisdom is a little bit different now and suggests more of a cautious approach as opposed to a black and white approach with employees physically or refusing to physically report. Next slide. So here are some legal policy tips for re-entering the workplace. So first of all, developing and implementing a social distancing policy that's enforced consistently. We do have, as Dr. Pelosi indicated, we do have a Department of Health order that provides parameters for social distancing in the workplace, in addition to CDC guidelines. These are important guidelines to follow for the purpose of legal risk management in other areas. The Department of Health order is not legislation. It's not a law that was passed in the House or the Senate or anything like that. That's just an order that's put out by an administrative agency. And the order itself states that it's the employer who's held accountable, and the employer can implement the policy as it sees fit, basically, in the workplace. So according to its own guidance, the Department of Health it doesn't look like the Department of Health is going to come knocking at your door and make you do certain things with regard to mask wearing and so forth, but the department would certainly hold you as the employer accountable. So develop a social distancing policy that works for your specific workplace. Every policy could potentially look different across workspaces. Requiring PPE, as in mask wearing. There is guidance from the Department of Health that Dr. Pelosi, I felt, covered pretty comprehensively. Encouraging and supporting enhanced workplace hygiene. This could even become part of your corporate culture over time. The Department of Health order encourages employers to provide hand washing breaks and to provide hand sanitizer throughout the office. Fourth, providing clear notices of expectations. It is not a requirement, but a suggestion that you place notices throughout your workplace to make sure that anyone entering the workspace is aware of your expectations of wearing PPE and of exercising appropriate hygiene. What this will do is demonstrate that you are exercising reasonable care to protect the health and safety of your employees. And then finally, consider daily wellness checks. Again, unless there is a probable or actual case in your workspace, there's no requirement to perform these wellness checks. However, many workplaces are now starting their day with a wellness check of what is the employee's temperature, how are they feeling, is there any reason to believe that they could be bringing COVID-19 into the workplace? Next slide. Thank you so much for your time and your attention. I would never claim to be as valuable in the COVID-19 efforts as Dr. Pelosi, but I am honored to have the opportunity to guide clients and assist clients through this process, and it is my pleasure to be here with you today, and I look forward to your questions.
Okay, thank you to both our presenters for the information. Obviously, this is a topic with lots and lots of questions, and I've been typing away here as they've come in, and I believe I have them all. Some of them are very similar, so I want to, I'll try and combine them, but I do encourage you when I ask the question and the answer is given, if you want to clarify or extend beyond that, feel free to turn off your microphone and jump in. I would just ask, if you're not talking, keep it muted for background purposes. So I do want to mix it up slightly to our normal. Normally at the very end, we ask Scott Shamandl from OSHA to give any update that he wants to do or anything we should know. I'm going to ask him to do that now, and then I do have a question that is so OSHA specific. So Scott, if you can share whatever you want to share, and then I'll ask you that question, and then we'll get into the legal and medical questions.
Very good. Good morning, everyone. Glad to be here. And I want to thank both Dr. Pelosi and Keely for fabulous presentations and wonderful information shared. I did take some notes during these both of these presentations, and I just kind of want to reiterate before I kind of get into a little update. And the update is going to be principally information that's contained on our website, particularly our dedicated COVID-19 webpage and the multiple subpages that are there. But Keely brought out, and as did Dr. Pelosi, some things that I just want to remind folks about with respect to some of the standards that we have. So one of the issues that I heard repeatedly is the temperature screening. And we've had a ton of questions relative to that very issue, because in some cases, it may be an element whereby which, depending upon who's taking the temperature reading, the record itself, the document I'm referring to now, may be considered a medical record. And at such point would need to be retained under the medical access to exposure and medical records standard requirements. So what a lot of companies are doing, and what I would truly advocate for is, doing temperature checks is fine, no problem with it, but I don't know if there's a need to record that particular element. And if the temperature is fine and the employee is, all other symptoms, if asked, we just don't record that record, and don't worry about trying to maintain that record for 30 years as a medical record, because that had been mentioned several times, and some companies are getting very aggressive with documenting all of that stuff, and that starts to travel down a different path, which I think we could stay clear from. A couple of other issues. I mean, I love the legal policy tips for re-entering the workplace discussion, because those bullet points are spot on and need to be re-emphasized. And one of the points that I wanted to quickly make was the social distancing policy and enforced consistently. That's something that we're seeing being developed in the Philadelphia area, particularly in the construction trades. They are now requiring that there is a pandemic safety officer on site. And this is an individual who's received some training, and one of their principal roles on the job site is to enforce the social distancing practices and to keep the workers on a job site as far away as possible. With the caveat, obviously, there are going to be some tasks and activities that have to be conducted where 2 or more people may be together. But therein lies that personal protective equipment component, which may have to be bumped up a notch, if you will, in addition to facial coverings, whether that's an N95 or any other type of mask. If 2 workers have to be within 6 feet of each other, some of the construction trades are now mandating the use of a face shield as an additional layer of protection just for that period of time in which they are close together. So anyway, let me jump back. Updates. Wow, I mean, our website has been principally dedicated, it seems, to the efforts with COVID-19, and the information on there is updated almost daily, quite frankly, particularly a lot of efforts and issues relative to your compliance activities. And I guess I'll say it this way, maybe the manner in which you can't comply with certain OSHA standards. So we do have a enforcement guidance document or memorandum that's out there that talks about the efforts for good faith that you as an employer will need to try to implement as you are trying to maintain your business, those that are essential and still working, and your efforts to be compliant with the OSHA regulations. So I'll refer to that in a few minutes, but I think Scott has a question to kind of start off with, and we'll go from there.
Yeah, thanks, Scott. The question would help if I pulled it back up, Dan. The question, it says, I have heard that if OSHA comes to inspect a site, or if in response to a complaint, that they will want to see that COVID-19 training has been done. We have 25 employees and 5 temps, and have posted COVID-19 related documents on the notice boards on each floor next to the time clocks. In this time of physical distancing, will this satisfy the training if we also have employees and temps sign a training log indicating that they have read the documents?
So I think there's 2 ways I can go about answering this. I think the short, simple reply is that I think it needs to be pointed out that obviously everyone knows that OSHA does not have a COVID-19 standard. However, that said, we do have multiple standards that have some applicability to efforts to mitigate or control the spread of COVID-19 in the workplace. So the short answer is, I think whatever means and methods of training you are doing for your employees to maintain social distancing, wear protective face coverings, doing the temperature screenings is great, absolutely fantastic. I think I want to remind everybody, though, that there are those standards that do require training that you'll want to make sure or reinforce or revisit, and that's personal protective equipment, obviously, whether it's gloves, facial protection, those that are requiring the use of respirators. Then we have a whole host of requirements there for training. And we also have the component, which I want to remind folks of, the record keeping rule requires that we make sure that employees understand the means and methods to report in a timely manner injuries that they may incur, including illnesses. And again, I'm talking about work relatedness. So we have to have that, that established work relatedness issue. The other topic of training, which I just want to remind folks of, I think everybody does a great job with it, is hazard communication. So if we are now doing some disinfecting or sanitation activities that maybe once was not being done by your own employees, if we're using chemicals that we had not used before, we certainly want to make sure that we cover that with them in a training module of some type. So the short answer is, for COVID-19 related, we have several standards that apply. Definitely make mention of those to your employees. And I will refer to the lengthier question or answer was going to be, relative to one of our guidance memos. So there is a good faith guidance memo on our website, which I think absolutely everybody should take a look at and just take the time to read it from top to bottom. It kind of goes through the elements that we are expecting, because again, OSHA is still conducting inspection activities. So we understand that you may not be able to comply with all of the standards, and what we want you to do is make a good faith effort to comply, and you can, fabulous, whether that's WebEx type training sessions or email notices that employees review and maybe send back that they've confirmed receipt and review of the material. That's great. But there are medical examinations, audiometric testing that can't be done. And those kind of things we understand won't be done. So your good faith effort is documenting what you've been able to do, maybe what you haven't been able to do as well, and then obviously your plans moving forward. So the timeliness of trying to rearrange those elements of compliance need to be part of your plan and documented. You do that, and we're not going to have any issues with whatever you're doing given this current situation we're in.
Okay, thank you, Scott. I just want to make a little comment here. It is 9:02, which is past the hour advertised, and we have not even scratched the surface on the questions. So Dr. Pelosi sent me a message privately, said he can stay on as long as it takes. Keely, are you under a specific time limit?
No, I'm glad to stay as late as you need me.
Okay, great. This is, reminder again, this is being recorded. So even if, your schedule allows that you do have to move on, you'll be able to listen to the recording if you want to tune into the question and answer portion. So I've been typing away here, trying to bucket the questions together because some of them are similar or related. So I'm gonna go by that as our order there. So we're all on the same topic. So the first one, kind of section, if you will, has to do with distancing. And if you can just kind of bear with me, I may just kind of put a couple questions together at the same time. So the question is there a recommendation on how many people per square foot should be allowed in the office at one time? I'll just leave it at that one. Is there a recommendation on how many people per square foot should be allowed in the office at one time?
Is that question for me or for Dr. Pelosi?
Either one of you can jump in if you know the answer or have a comment.
Well, under the Department of Health's order, there's a recommendation, and I guess it would be a little more strongly than a recommendation, but a directive to have no more than 10 individuals congregating in a room for a meeting at a time. But just to remind you, I think as I indicated during my presentation, that the Department of Health's order the Department of Health's guidance with regard to its order specifically states that it is up to you as the employer to manage your workspace. So the prevailing wisdom would be to exercise reasonable care. And I think Dr. Pelosi would have a better handle on what, from a medical perspective, is reasonable care. From a legal perspective, I would advise that you are consistent whatever your policy is, you're consistent in its implementation so that employees are aware of the standard and the same standard is applied to all employees and all employee classifications.
I'll also add to that that the Secretary of Health's order states that if you limit to 50% of your occupancy certificate, that's also one of the standards they use for occupancy or density within the workplace. But from a practical basis, if 6 feet is the distancing that we are looking at, if inadvertently people are coming closer together, PPE sanitation becomes even more important. So face shields, goggles, because if droplets are escaping around masks that are gapping and so forth, PPE becomes even more important. So I would suggest that if there are occasions where the density is higher than it should be, or maybe that it's a riskier situation, then the PPE issues become even more important.
Thank you. One question that's almost a little follow-up on that one. The person states that there's a good amount of distance. They only have sometimes 1 or 2 people in the office at the same time, and there's at least 10 feet between them. So they're asking, should we require masks and/or gloves in that scenario?
Yes. And the reason is, the answer is yes, you should require masks and other PPE because, the intention is not to come closer, but I've seen a number of times where masks were required and people actually came closer together when they weren't wearing them than they planned on coming. And so I would say definitely yes, they should be required.
Okay, and then looking for advice, should we keep our buildings on lockdown and not allow the public to enter?
There's really no legal reason to keep buildings on lockdown, especially when if your business is an essential business that's open for service right now. The Department of Health's order does encourage employers to continue to monitor who's entering the workplace, to know, first of all, to know who's entering the workplace, and secondly, to do the same type of safety monitoring you would do with regard to employees if there is a probable or confirmed case in the workplace. There are some employers who have, although not required, opted to perform wellness checks on those entering the building. So in other words, for certain service providers, before a client enters the building, the client needs to advise the service provider that their temperature is below the threshold and that they are not experiencing symptoms. So really, whether you have to do it, I'm not sure you have to do it, but there is some ability still under the Department of Health's order to control who is entering your workplace.
Okay. This is getting a little bit away from distancing now. This one seems like a pretty specific scenario. If an employee, well, actually, general application though, if an employee has a lot of PTO hours and tells us that they are afraid and doesn't want to work, can we charge their PTO account for the time? Does she take it unpaid, or is it her choice? Their choice, the company's choice, would be to charge her PTO. But is that acceptable?
So understanding the question correctly, this is not, during my presentation, I encouraged you to separate employees into 3 categories. So I'll go back to that model. We would separate employees into 3 categories of, first of all, those who are entitled to leave. So with this individual, I would ask the employer, are they just simply afraid for, I think Dr. Pelosi referred to the worry well, are they just simply a worrier? Or are they somebody who actually has a COVID-19 protected reason for requesting the leave? If the individual has a COVID-19 Families First Coronavirus Response Act protected reason for requesting the leave, you as the employer you would be in violation of the law for compelling that individual to use PTO time. However, If that individual does not have a legally protected reason for leave, and fear in and of itself as a single solitary factor is not a legally protected reason for leave, in that case, you absolutely can require the person to use their PTO time to take the leave. Just to bring in another legal point, under the Fair Labor Standards Act, employees are generally divided into two classifications, which are exempt and non-exempt. Employees who are not exempt from the Fair Labor Standards Act, who are your hourly wage earning employees, these employees have no entitlement to be paid if they are not reporting to work. For your exempt salaried employees, there are different restrictions that would almost take another hour to explain. But particularly if the individual is an hourly wage earning worker, they would have no entitlement to be paid if they're not reporting to work, and there's no legally protected reason for them not to report to work. In all cases, certainly, exempt or non-exempt employee, unless the legally protected reason would apply, you may generally compel the use of PTO time for that individual not reporting.
Okay. The next subsection here is a lot to do with temperatures, and one of them that we have in a multiple different asked in a multiple different ways is lost my spot. Here we go. Taking temperatures. This one, and I'll start with this one. We're a non-essential business and have been closed to the public since mid-March. Based on the guidance from Dr. Levine on the middle of April, it appears that once we are allowed to reopen, we should temperature check our employees. The person says they know the rules around sending them home if they have a fever. But if we are open to the public, should we also be taking the temperatures of our customers as well for the safety of our staff and other patrons? That's a fun one.
I can answer from a medical perspective what I would like to happen, but from a legal perspective, I would rely on Attorney Collins' opinion. If it depends on the type of business and where that customer is going. I mean, if they're coming up to they're entering a foyer and going to a partitioned registration person or kind of a bank teller where there's a wall there, then I would think that it's not warranted if there's a quick transaction. Also, people at work should be wearing masks. So I'm thinking that there would be very little interaction, and that person should be wearing a mask when they come in at this time. So I'm thinking in those situations would not be necessary medically. However, if it's a type of business where the client is going to be spending significant time interacting and maybe at closer distances than we would like and spending significant amount of time, then from a medical perspective, I would like to see that person get a temperature screen before spending so much time in proximity. For the legal aspect, I'll rely on Attorney Collins.
Just commenting from the legal perspective, I would do everything that you can to avoid alienating customers, and having them come in and take their temperature could be alienating. There's no legal reason to do it. As Dr. Pelosi indicated, there is unlikely to be a medical reason to do it. There are certain circumstances he described where it could be useful. I would recommend avoiding having that be a policy or practice of your organization to the greatest extent possible. There, in the Department of Health's order, there's a requirement to require those entering the workplace to wear masks. And if that's a legal requirement that's in the Department of Health's order, your clients and customers should be understanding of that. And you can even kind of couch it to them in that way in your notices that per the Department of Health's order, you are required to wear masks in entering this workplace. That takes the burden off of you as the employer, because, you know, it doesn't feel like it now, but one of these days this will all be over and we're all going to want to go back into business. And I wouldn't, as an attorney, want to lead you down a path of alienating the customers and clients you're going to depend on to bring your business back up again. So there's no legal requirement to do it, except unless there would be some medical necessity. I would recommend against having people have temperature taken before entering your workplace who are not your employees.
A spin on that question, we received from two different people that says, as an educational institution with the EEOC guidance reference for employee screen, or I'm sorry, will the EEOC guidance reference for employee screening apply in the same manner to our students? Should we have different policies for students and employees on wellness checks? And the another portion of that from the other person was, do students need to sign some waiver related to returning to clinical as it applies to hospitals? Again,
Okay, so
both
just
students.
but speaking in terms of the situation from the perspective of an educational institution, we represent a lot of educational institutions. Most are, in fact, all are functioning remotely right now, not entering into campus. I'm not really sure. I feel disqualified to speak from the perspective of a medical institution and their interns and so forth. I really don't practice in that area. I don't know if Dr. Pelosi would have any guidance there, but just in terms of the educational institutions, please hang on and do not develop any student policies or practices for the 2021 school year until we get some more direction from the Pennsylvania Department of Education. We've been, as education attorneys, been somewhat reactive lately because there's just something new every single day. And the law, as it pertains to students and the protection of students, can be very different from the law pertaining to employees. So as we're talking about policy re-entering today, educational institutions, please hang on until we can get some guidance from the Department of Education. You don't need to come up with any practice just yet. I would advise you against doing so with respect to students, because I mean, we don't even know whether we're going to be opening up in the fall. So I would recommend for that person, I think you're thinking along the right lines. That's good thinking, to be trying to think ahead as to what we're going to do for the next school year. But I would recommend that you just hang on and talk to your solicitor, your legal counsel, because those laws are in flux and change every day.
Dr. Pelosi, you want to comment on the hospital portion of it with students?
Yes, once again, we're trying to limit as much contact as possible. So a lot of our education programs have gone purely electronic. So once again, really limiting and not congregating and so on and so forth. For those people in clinical situations, that's a different story. But for purely the didactic situations, we're limiting to electronic right now.
Okay. The next area, and I apologize, I'm trying to put a lot of this together on the fly here, but the next couple I have here, I would say, are a little more PPE related. The one question here is that Dr. Pelosi mentioned a diner with plexi screens for airborne particles. Is it now considered that it lives in the air, the virus lives in the air for some time? I'm sorry if I said that wrong. Is the virus considered, is it considered that the virus now lives in the air for some time?
The virus can live for some time in the air and on surfaces, which is concerning. And that's why we like to advise, and that's why all the advice is to advise sanitizing surfaces, including floors and other surfaces, especially if you have fans in the workplace, which might not aerosolize, but make the particles, the virus particles, airborne again, and why ventilation is important, especially after a known exposure, where we like to ventilate out the space and then clean it down. So it can live in the air for a period of time. It can live on different surfaces for differing periods of time. Usually, porous surfaces, it lives less time on those. So we talk about maybe hours to a few days. And on hard surfaces such as plastic or metal, we look at least several days, up to 5 to 7 days. Different research is finding different things, but yes, the virus can live in the air and on surfaces for a time.
Okay, and let me quick. Oh, I'm sorry. I'm switching gears a little bit. There was a part two to that one that goes more back to taking temperatures. The question was, can I take temperatures of an interviewee to protect my team? And I believe there was another one down here that just does say what is the impact to the onboarding process, which I think would be along the same lines.
Yes, so yes, you may. I opened my presentation with the three categories of policy changes. One, the changes you need to make. Two, the changes you may make for best practice or may want to consider making for best practice. And three, changes you may make if you want. So in other words, the third category is changes that are permissible to make. According to the EEOC, Equal Employment Opportunities recent guidance, employers are permitted to take temperatures in the workplace, and this would certainly apply to applicants. The EEOC guidance generally applies to both applicants and employees for most circumstances. So there would be nothing wrong with taking temperatures of applicants. You may want to consider providing alternative means to interview if the concern is that someone has an elevated temperature and therefore you do not wish to have them in your workplace for an interview. You may want to consider remote interviewing or some other form, just simply because now I don't want to get outside my wheelhouse here, but it's my understanding that that the temperature alone does not mean someone has COVID-19. So someone could have an elevated temperature and not have COVID-19. Likewise, someone could have COVID-19 and may not necessarily give a reading of a high temperature. And Dr. Pelosi can correct me if I'm wrong, but you wouldn't want to exclude possible candidates from the interview process entirely on the basis of just the temperature screening. But yes, if you would like to undertake temperature screening for applicants prior to their ability to enter your workspace, yes, the EEOC's guidance allows you to do this. Do you have to do it? No. Should you do it? I don't necessarily think it has to be a best practice for the workplace. It would be just more so what works best for your particular environment. My advice would be just to try to find alternative means to interview that person if they are available and qualified for the position.
Okay, and one other follow-up question that just came across for temperatures. Do I need to retain the medical information for non-employees that I temperature check?
There's no need to retain the information. The only time that may come in useful would be if an individual complained that they were denied access to the workspace as an applicant for discriminatory reasons. The information that the employee had an elevated or that the applicant had an elevated temperature could be important information in defending the employer's position that they were denied access to the workplace because of an elevated temperature. That being said, that's the reason why my recommendation is to maybe find another platform, such as virtual interviewing or telephone interviewing, so that an individual would not be denied access to the workplace to go through the interview process if they're available and able to perform the functions of the job.
I think that question would also apply to visitors, or was also generalized to if it includes visitors and other non-employees. Would those medical records need to be retained?
I would recommend against that. If you're having individuals from outside the workplace enter your customers, your clients, first of all, you do not need to take temperatures, and there's really it doesn't sound like there's legal or medical reason in most normal circumstances to take the temperature of your clients or customers. And you wouldn't want to retain medical records of clients or customers. I would recommend against that.
Okay. For Dr. Pelosi, the questions, can N95 masks be reused if worn in a non-healthcare setting?
So Scott Schmidl may have some advice on when they should be replaced, but the answer would be yes. Obviously, if they are cared for properly, if they are not soiled or contaminated, they can be reused. The suggestion would be to keep them in a brown paper bag or something permeable so that the humidity can air out and they can be protected from other contaminants. But yes, they could be reused as long as not damaged, soiled, or otherwise become ineffective.
And then a part two to that, is there a way to sanitize them?
There are some novel ways that we're looking at sanitizing them, and there is some guidance from some of the manufacturers on using ultraviolet treatments to some of them, and then recently some hydrogen peroxide vapor treatments. But you have to keep in mind that if you're wearing the N95 or using a company N95, that you query the company's guidelines for that, because a lot of these have to do with the materials they're made out of, and there's very specific instructions on how to do that without deteriorating the mask material and making it ineffective. So yes, there are ways to do that. They may not be widely available, but they do exist, and I would request that you contact the manufacturer to ask about their specific manufacturer's directions for that.
Okay, thank you. Next question, also related to PPE. There seems to be some mixed messages about gloves. Does an employee need to use gloves, or is hand sanitizer and proper hand washing along with masks sufficient?
I would certainly defer to Dr. Pelosi for his for medical opinion on whether those measures are necessary. The Department of Health's order does not go that far. The Department of Health is not requiring, by its safety order for Pennsylvania businesses, to require the use of gloves in the workplace. The department's order speaks more to appropriate sanitizing and hygiene practices, as opposed to going so far as to require gloves. There's nothing prohibiting you from making that requirement, aside from just supply. You might have a difficult time obtaining the supply that you need to cover your entire workplace. But if you are able to obtain that level of supply and you feel that that's necessary to protect your workplace, there's nothing prohibiting you from doing so. From a legal perspective, I would discourage getting into a situation where certain employees are able to have gloves and certain employees are not, because that would give a health protection that's inconsistently applied, which could open the door for liability to employers in some ways. But generally, there's no requirement for that level of PPE.
Dr. Pelosi?
Yeah, and from a medical perspective, if gloves are not needed due to the work process, I would not advise them. Now, in healthcare, we use them to prevent infection and transmitting infection as we perform different procedures. But in the workplace, unless you're working with a procedure that requires gloves, they're not necessary for proper hand sanitation. And they may also provide a false sense of protection, where a person puts on the gloves and then contaminates the gloves and proceeds to contaminate their face or other surfaces. So they may feel that they don't need to sanitize the outer portion of the glove either. So you can cross-contaminate items, or you could contaminate yourself when you're removing them and so forth. So unless you need them for the process, I would say that not necessarily recommended. It is, however, of course, recommended to frequently sanitize and wash hands, but the gloves are not going to protect you any more than doing that. So it's really the procedure, the process that you're involved with that drives that.
Okay.
So if I may, Scott, I support both replies, 100%. I think just keeping in mind too that, every workplace, employers are supposed to conduct a hazard assessment. So to Dr. Pelosi's point of view, depending upon the process, that's going to dictate and drive what type of PPE is going to be used when. The other piece I would offer is, please keep in mind, we do have some operations that, we may be using shared tools or equipment. And that might be a time and opportunity to kind of reassess the job tasks that are being conducted, and are there tools, equipment, or machinery that more than one individual may be working with. We may want to consider looking at that from another level of PPE that we may not have before. That's all I would offer.
Thank you. The next question I have in about 6 different forms, so I'll try and combine it all. And this all does relate to Hipaa, which I think both of you can, both the legal, but then how obviously we live with that in the hospital and take it very seriously. So the bare bones basic of the question is, how does Hipaa come into play with recording employees' temperatures?
Speaking first from a legal perspective, and then I'll gladly turn it over to Dr. Pelosi because he actually deals with Hipaa every single day. If you are not a medical organization, Hipaa is not your area of legal obligation. That's a common misunderstanding, and it's an understandable misunderstanding because everywhere you go, you see Hipaa, but that really applies more to Dr. Pelosi, LVHN, and medical entities. For the general employer, your obligation is found under the Americans with Disabilities Act, ADA. According to recent EEOC guidance, which again is the agency that oversees the implementation of the ADA, confidentiality laws are still very much in play under the Americans with Disabilities Act. Under the ADA, the confidentiality requirements state or provide that you need to contain employee medical information in a separate confidential file that is available only on an as-needed basis. So in other words, if you are here at this meeting as an HR director, your responsibility is to keep the temperature screening results, keep physician certifications, keep any medical information you may receive from employees during this time in a separate file to be disclosed only on an as-needed basis. However, that being said, there is no law that would prohibit, and in fact, employers are encouraged by many different areas of guidance to disclose to the employees in the general workspace of anyone who entered the workplace with an actual or probable case of COVID-19 that they may have come into contact with COVID-19. That is a requirement under the Department of Health's safety order, and it is also required to manage risk of legal liability in many areas. And you may be wondering, wouldn't disclosing that fact open the door for other employees to kind of figure out who it is who had COVID-19? Yes. However, going back to my presentation of the legal liability risk management guidelines turned on their head at this time, informing employees of the potential that they came in contact with COVID-19 is much more important from a legal risk management perspective than making sure that the employees have no idea who it is who had COVID-19. Even the EEOC guidance acknowledges that yes, employees could figure out who it is. However, it's more important at this time that the relevant employees, as in those who are in that employee's workspace, know that if they start experiencing symptoms, they need to get an examination or a test immediately because they may have come in contact with COVID-19. So confidentiality obligations still basically the same. However, there are some risk management concerns, such as disclosing the possibility that an employee came into COVID-19 that could outweigh some of the general prevailing wisdom with regard to confidentiality.
Okay, that opened up a lot of follow-up questions. And Dr. Pelosi, if you don't mind, I want to just kind of build off that, and then we'll switch over to you. So with just as a clarification question, and I know this is something we're involved with occupational medicine, is now, companies or, we'll be able to in certain cases help facilitate that temperature screening for companies. I'm going through, here's the realistic scenario. I'm coming through and I have, 200 employees coming through. Everybody gets a temperature check. The prevailing goal of that is to say people who don't meet the temperature or screening questions criteria are going to be dismissed and sent home to recover. Those, of course, would get communicated to the company as this person's not coming in due to the screening. But then is the company required to be keeping or that report that says these are all the people that their temperature was fine? And are they supposed to say this was their temperature? Their temperature was 98.4. This person's was 98.1. How specific or non-specific must that be? Because general wisdom is as least specific as possible.
Yes, Scott, I completely agree with your understanding of the general wisdom being to keep records that are the least specific as possible. There are two concerns when you are, and for those of you who I've spoke with who are HR directors, that you already know that this is my general guidance to clients, but really for all of you, as you are documenting employee issues as an HR director, what you're essentially doing is building a file to protect the organization. And I'm speaking here in terms of your legal liability. There could be a different perspective from a medical practitioner like Dr. Pelosi, but from the legal perspective, what you're doing is you're developing a file to protect the interests of the organization. There's no need from a legal perspective to document the specific temperature. The file that you're preparing from as a business leader or HR director is the legitimate business reason for sending the employee home. You would certainly want to create and document to a file as a legitimate role of the business leader or HR director what the business reason was for sending the individual home, such as an example would be the individual's responses to COVID-19 wellness check. That's a vague but yet supportive reason for sending the employee home. There's no need to document the specific temperature. And what, as was indicated by Scott earlier, there are reasons why you might not want to retain those documentations, such as document maintenance requirements and so forth. So we may not want to get that specific, and there's really no legal reason to do so.
One follow-up that just came across was, so each employee needs their own medical file to record these temperatures.
Yes, yes, yes. Whoever asked that question, great question. If that's, if you take a handful of things away from this presentation, that's an important one to take away. If you are not already creating separate medical files, it's crucial that you do so to meet your confidentiality requirements under the ADA, Americans with Disabilities Act, which does in fact require a separate medical file for employee medical information. The EEOC, Equal Employment Opportunity Commission, has verified through guidance that under normal circumstances, and indeed through our circumstances now, the temperature taking is a medical examination. It's a more benign form of a medical examination. You're not asking an employee to go through a full physical, but it is, for legal purposes under the ADA, considered a medical examination. Therefore, any data collected must be maintained confidentially and disclosed only on an as-needed basis. That's yet another reason, in addition to what Scott from OSHA stated earlier, that we may want to be careful about what we are retaining, because whenever you create a medical file, there are legal requirements and legal implications for what happens with that file document and information.
So just to clarify, just to match the two answers there, if you are maintaining a record on, let's just say, if I just want to summarize it, obviously you want to keep it, as you stated, if they failed the screening. If they pass the screening, there's no need to maintain it, but if you do, that needs to go in a medical record.
That's correct. Yes,
Okay.
that's correct. There's really no legal reason to maintain a file that they passed the wellness check. The only legal reason would be to document a legitimate business reason for sending the employee home if that reason was that they, for one reason or another, did not pass the wellness check.
Okay. I think that's going to be a very popular thing, so I just wanted to clarify that. Dr. Pelosi, I apologize to you. Is there anything you wanted to chime in on that particular question?
Yeah, I agree. There is really no reason to maintain a log of normal temperatures, and I would dissuade companies from trying to maintain that. And I could see the reason that you would want to retain in a separate medical record an abnormal finding, which would lead to an action. And as Attorney Collins says, keep it in a separate medical record. So I agree with everything that she had said, and there's no medical reason to advise otherwise.
Okay. So and I think you touched on this, Keely, but it's the question is just over how you do it in a HIPAA confidentiality compliant way when you need to pull aside an employee that has a fever and others would see this. We've had that asked a couple times, but if you could just kind of reiterate or touch on that one just a little bit.
Yes. So pulling aside an employee to speak with them could indicate to others who are coming in on that same day that the employee, for some reason, did not pass the wellness check. So however you set up your wellness checks in the morning, it's best to do it in a way that's confidential and provides as little information as possible to those who do not need the information. So an example of something that some employers have been doing is to do the wellness check by either phone or by email. There are some employers who have provided a kind of one-sheet wellness check to employees that they are to complete an email in the morning. That's one way that you would avoid the long line out the door with employees having their temperatures taken. They can take their temperature before they leave the house and affirm for the employer that they are giving an accurate reading. That would also avoid the employer knowing the specific temperature and only knowing what they need to know, which is the temperature was not elevated or the temperature was elevated. So that's one way. Another way would be to just do wellness checks by phone, to contact the employee and discuss whether or not they've met the particular criteria by phone. In higher risk places like a hospital, I think that the process that Dr. Pelosi spoke to makes a lot of sense to do the wellness checks actually at the door. But in most of your standard manufacturing service provider settings, you're not going to have a whole lot of COVID-19 cases coming in and out of the door. You're not legally required to do temperature checks anyway, unless you've had an actual or probable case. So trusting your employees to accurately report by email or by phone might be better in meeting your confidentiality standards and also not overreacting. So having your reaction be proportionate to the circumstances.
And just to clarify, because this was worded a couple different ways from a couple different people, but if you envision that long line of people coming in, if someone gets the temperature and there's a relative distancing for privacy and the person is pulled aside from the line and not allowed to go in, is there an issue with confidentiality? We didn't say anything, we didn't hear anything. It's just by action of seeing someone be pulled aside. Is that safe from a confidentiality point of view?
Based on guidance that's been released by the EEOC, in my opinion, that is safe during the time frame where the pandemic is considered more active in the population, because it's considered at this time a direct threat to the workplace. That is, however, an exception from the way that the workplace is generally conducted. And certainly screening employees at the door is a major exception from how the workplace is typically conducted. For risk management reasons, unless you are, for example, a medical entity or some type of entity that is frequently bringing in individuals who have COVID-19, you may want to stick to wellness checks by email or by phone with employees taking their own temperatures prior to coming into work, as opposed to the long line scenario of employees entering for the day. Again, that's just a suggestion. It's up to you how you want to manage the workplace. And to Scott's question more directly, no, I wouldn't view that as a violation. However, that it does raise some confidentiality concerns and also some just practical administrative concerns of exactly how that would work every single day, having employees line up for wellness checks.
Okay. Dr. Pelosi, did you have anything you wanted to add there?
No, I have nothing to add to that. Thank you, Scott.
Okay, sure. Couple of variation questions were just, asking employees if they're experienced COVID-19 symptoms as part of the pre-screening prior to entry. Is that acceptable? And from what you have stated, I think the simple answer to that one is yes, that is acceptable under the current circumstances.
Yes, that's correct.
And the other one was, is there legal considerations for screening testing of employees versus screening testing for others who visit the facility?
Yes, I think there would be different legal considerations. So to somebody, one of the reasons why individuals might choose to be an employee of an organization as opposed to an independent contractor is because of all of the various legal protections that apply to employees. The confidentiality obligations, for example, unless you're a medical entity that has to comply with the requirements of Hipaa. But the confidentiality rules would generally only apply to your employees. So there isn't really a confidentiality rule for individuals entering from the public. Also, in the Department of Health's order, the screenings could be applied to both employees and individuals entering from the public, depending on the circumstances of whether or not there has been an actual case on the premises. There is, from a practical and business perspective, a different way that we would treat employees versus customers, because under the law, the employees are under the direction and control of the employer, whereas your customers and clients, in a way, they direct and control. In some ways, they have a direct impact on whether the business is going to continue as an ongoing concern. So you, as the business leader, may want to exercise a little more control over your employees than you would under individuals entering the business. That being said, that's your workplace, and you have the ability to tell people, that they're not welcome to enter if they're experiencing certain symptoms or unable to pass the same wellness check as your employees.
Okay, I have two others on that, and I hate to put you on the spot on this one, but someone wrote in that their interpretation of reading the Pennsylvania guidelines, that it stated that temperature self-checks were not permitted. And the question was, am I reading that wrong?
Well, I mean, that's a good point, that businesses might want to be careful that somebody's accurately reporting their temperature. I think to me that sounds like it could be misinformation, just because when this order came out, there was a lot of concern among businesses about overregulation, because it appeared as though all employees had to have temperatures screened and all entrants into the workplace had to have temperatures screened. There's nothing like that. I mean, you maybe could have, for the person who asked that question, perhaps you could have seen guidance to the effect that employers should be careful about employees accurately reporting, but there's no legal requirement that the employer, as opposed to the employee, took the temperature. If you as the employer are hesitant to rely on the employee's self-report, that's a different story. You can, as an employer, decide you're not going to rely on the employee's self-report. However, there's nothing in a law book or a legal requirement that would say you cannot rely on an employee's self-report. Even the Department of Health order itself is to be enforced by you as the employer. It's not a law that was passed down by the legislature. According to the Department of Health's order, you just need to temperature screen if there was a probable or confirmed case. There's no way. They just say you have to screen before the employees actually enter into the workplace. It doesn't say the employer itself has to actually do the screening. You can rely on the employee's ability to report that screening.
Okay. And related to that, is it okay to have associates sign in that they completed the temperature check, or is that considered a medical log?
That wouldn't disclose any medical information. If you're just having someone sign in that they completed the temperature check and there were no problems or something like that, that wouldn't necessarily raise confidentiality concerns. The concern would come in if employees were seeing one another sign in with the particular temperature screening, with the particular number next to their name, or some other type of identifying medical information about that employee.
Okay. Sorry,
Scott, the only thing I would add to that is, if be careful of shared tools. I mean, just like the, if we got one common pen being used to sign in and sign out, just be mindful of that.
Yeah, that is something we've been addressing as we've been setting up the logistics to these. If you're handing them a clipboard with a pen on it, then you got to sanitize those before you hand them off. Thanks, Scott. Let's see. As an employee's experience. Yep, we got that. Got that. Okay, so moving on a little bit from the Hipaa side, or the confidentiality, employee comes in and states that they feel ill. We send them home. Who pays? PTO, unemployment, the employer?
That's a good question, and that really goes back to the culture and policy development during the COVID-19 era. There are now, just starting out with going back to the 3 categories of changes you need to make, changes maybe you should make, changes you may make if you want to. As to employee absenteeism, the changes that you need to make are the changes that are required under the Families First Coronavirus Response Act, which does indeed require full pay without the use of PTO if the employee has a qualifying reason, and one such qualifying reason is quarantine. If the employee is simply not feeling well, that in of itself does not appear to be a legal reason for taking the leave. However, if the employee leaves not feeling well and is placed under quarantine by either a physician or some other type of, or some agency, then in that case, the employer would need to provide paid leave under the Families First Coronavirus Response Act. And if this is the first time you're hearing about that law, it's a little bit too complex to explain in this forum. And I would suggest you reach out to your labor counsel, your solicitor, or my email address is there. You can always reach out to me. So that's a change that you need to make. Changes that you may want to consider, or for best practices, is if you as the employer are requiring the employee to go home, and you as the employer would like to create more of an atmosphere during the COVID-19 time of managing the risk of spread of the virus, as opposed to just strictly managing PTO, you as the employer might want to, in that case, not charge the employee PTO and instead pay them for that day. If the employee is exempt, meaning they are exempt from the minimum wage requirements of the Fair Labor Standards Act and they're paid by salary, if you send them home, you may require them to use PTO. However, if they don't have any PTO available, you as the employer are legally obligated to pay them for the days that you're sending them home if they're performing any work during that work week. So that's so you may, from a legal standpoint, want to manage your risk by paying for those days that you're sending employees home. And then finally, changes you may make if you want. The law does allow you just to require employees to use their PTO. You don't, as long as they're not asking for leave for a coronavirus qualifying reason under the Families First Coronavirus Response Act. You as the employer may require that employee to utilize PTO for the days that they're going home, even if you are sending them home. However, from a best practice standpoint, legal risk management standpoint, you as the employer may want to consider just paying out the days as opposed to requiring PTO, in the interest of encouraging employees to leave the workplace if they're having difficulty to manage the spread of the virus in your workplace.
Okay. There was a follow-up question here, and I just want to acknowledge, well, not a follow-up, but a related. I just want to acknowledge that the person wrote in for Keely, please go into more detail about Family First Coronavirus Response Act, and does it apply to all employees? I think, I mean, you've touched on it more since the presentation, but from what I'm hearing, that's a whole other can of worms that we probably can't go into, but perhaps that's a conversation that can continue offline if there's any additional questions. Is that fair, or is there anything else you want to add in on that?
Yes, absolutely, Scott. I agree with everything you just said. So the Families First Coronavirus Response Act is actually a legislative enactment. So that is a law. It's not just guidance, not just an agency order. That is actual law. and it's an expanded reasons for FMLA leave, and also it provides another form of leave called emergency paid sick leave. So this is something that you'd want to check with your legal counsel about, or as the slide says, I would love to hear from you. You may certainly email me for further discussion. It tends to be how this law would apply to your organization situation by situation. Some smaller companies may even qualify for an exemption. So it's a whole other discussion that I could do a 2-hour presentation on just in and of itself. But just please be aware that that exists and is a reason to exercise caution when saying, when addressing employees' refusal to return to the workplace.
I just want to build off that with my own statement, and this is not the typical that we would do at these safety peer groups, but for both Dr. Pellosie and Attorney Collins, there is a lot of questions on this, and we're doing our best to answer anecdotals or specifics. It is recommended that, you may want to go the route of actual formal consulting. I don't know how that works on the legal side. Through occupational medicine, we do have actually a consultation where you can retain a doctor on an hourly basis, or even as a medical director, where they can just do one-on-one, asking specific questions and helping with policy development. And normally I don't say things like that, but this is such an in-depth thing. A lot of presentations I've seen through LVBCH, Chamber, and other places, NCDC have made recommendations at this time to possibly have a chief medical officer or a medical director, just because of the high level. But okay, moving on. Here, this one's a little bit more specific, but on the same lines. Going to asking employees about a sick note when they take time off. The number of days that's allowed is varied by union or employee group. This company relaxed that requirement during this time, but the question is, do we need to continue to have that relaxed? Are doctor's notes still difficult to get? And they are talking about non-COVID related sickness.
As a general practice, I would recommend continuing to require doctor's notes, particularly if you're a unionized employer, because typically there is a practice or a legal doctrine in labor law called past practice doctrine. Typically that would not apply to this situation and just simply requiring medical documentation from a legal perspective. However, from a practical perspective, unions will tend to seize any moment they can to say to the employer, hey, well, you didn't ask this person for medical documentation. Why are you asking it from this person? So even though the medical documentation requirement, generally speaking, would not fit within the legal doctrine of past practice for those of you who are unionized, you would still want to be very careful when addressing a union to make sure you're treating everybody the same and that you're following your general policies to the best extent you can. I have been recommending to employers that they start out by requiring the medical documentation from employees who are claiming that they require leave for a medical reason. Under the Families First Coronavirus Response Act, there are specific items of documentation that you may require from employees. So that's handled a little bit differently. Again, check with your labor counsel on that. But generally speaking, if you have an employee out for a reason that's just under your general PTO policy, that's not related to Families First Coronavirus Response Act and its various regulations, I actually would recommend that you continue to seek medical clearance. If the employee is not able to provide that medical clearance at the time due to hospital overload, we may want to be a little bit more understanding that we normally are, or even defer requiring that documentation until the employee is able to provide it. However, I can just tell you from a practical perspective, with the clients I work with, I have not seen any situations where an employee who was out ill for an extended period of time was not able to get some type of a certification from the physician to justify their absence. So bottom line, especially if you're unionized, I wouldn't give up your normal rules. I would just be aware of the practicalities of the situation that we may need to defer or somehow relax the standards for at least a period of time.
Okay. This next one kind of hits both sides, I believe, the medical and the legal. The question is, if the employee tested positive and has a mild case, aren't they required to have 2 negative results before returning to work? And what is the time frame for the tests?
I would defer that to Dr. Pelosi. I'm really not sure what would indicate that an employee is completely clear of COVID-19. I'm interested to hear his response, and then I'll follow up with what my recommendation has been to clients in returning employees to work.
Yes, in my slide set, I've included a program by which the employee can be cleared to return out of isolation and back into work without the need for further testing. Testing has been difficult to obtain in some circumstances, and the proof of negative testing is not required to remove them from isolation or return them back to work. However, along those lines, there are other precautionary items that apply, and I've listed them previously, such as they have to be 10 days from their first symptoms, and they have to be symptom-free and fever-free for 3 days after removal from their or after the symptoms resolve. So there are those parameters I listed in a previous slide. I would apply to those, but they do not need to use that test to return to the workplace. That was just one of the options that were proposed, and we're relying less and less on that now because some of the people are not getting tested who have COVID-19 to begin with. So they're presumed or suspected of having COVID-19. They fit the clinical diagnosis, and they most likely have had it, but if they haven't had a test and don't qualify to get a test, or if they've been ill at home and don't have access to the test, we're not using that, and the CDC has provided guidance for removal from isolation now without the need for those proof of negative tests.
To follow up for in managing the legal risk, my recommendation to clients has been to obtain physician's documentation to support that the employee may safely return to work. Because we're not doctors, as lawyers, we don't typically recommend what type of documentation is required. Physicians are in a much better position than lawyers to understand and advise on what specific testing or standards should be met for safety in returning to work. So typically from a legal perspective, we would not tell a client, well, you need to have 2 negative tests or something like that. The legal advice, which is supported by the EEOC's guidance and the Department of Health's order, is to require documentation indicating that the employee may safely return. We don't, from a legal perspective, suggest or recommend or even speak to any particular testing or specific measure. We would leave that up to the physician to make the determination as to what standard would apply, and then to verify for the employer so the employer can build its file and maintain the documentation needed for its workplace protection that the employee has been certified by a physician to return to the work environment.
Thank you. And just one other note there is those of you who are familiar with occupational medicine, there's an exam or evaluation referred to as a return to work exam or evaluation or fit for duty. And that does apply for COVID. And the point of those in general is to have someone, a medical professional on behalf of the employer, beyond what the individual employee is stating or their personal doctor is saying. It's someone who's providing that evaluation on the company's behalf and indicating whether they feel it is safe for that person to return to work. That does apply and is available for COVID. If you are, if it is a concern or it's a worry in your policy, that is a consideration that can be made in a tool that's available to you as well. Okay. Okay, the next one is somewhat related to that is if an employee is calling in to say they do not feel well and they are recommended that they call their doctor and get tested, but then the doctor tells them it's not necessary to test, but is keeping them out of work under precautionary quarantine, is the employer obligated to tell other employees of the clients that they may have been exposed, although there is no test result?
So, excellent question. I'm glad that somebody asked that. So, I heard in that question both employees and clients. First of all, generally speaking, and again, there are, I think, 200 attendees here, and I'm sure out of all of you, there's some type of exception to this general rule. But generally speaking, there is absolutely no need any time, anywhere, for you to be informing your clients that someone in the workplace had COVID-19. You can't, put the genie back in the bottle, I guess is the saying, or whatever the saying is, that like once that's released, there's no way to take it back. And now you have the public receiving information that there was a virus, a deadly virus present in your workplace. That's not going to help you very much in bringing yourself back into business. And there's absolutely no legal need to do that. You have no legal obligation in that area. From a tort perspective, you shouldn't have employees in the workplace who have a probable or confirmed case of COVID-19. That could allow a client or a customer to file a tort action against you if you have a known case circulating in the workplace where a client or customer is. But notwithstanding that, there's really no legal obligation to notify the client or customer, and that could create much more problems than you ever would need to from a legal perspective. But please keep in mind there are 200 people here. You might want to check with your own legal counsel to confirm that's right for your organization. But generally speaking, no way in the world, no reason to notify clients or customers that you had a virus present in your workplace. Secondly, moving to employees. For your employees, it is recommended, and in part of the Department of Health's order, that employees within the workplace vicinity of the probable or confirmed case are notified. The question referred to the lack of testing. That's common. We're seeing that commonly in the workplace, that there's an employee who comes back with a physician's note where the physician stated that testing was not done. However, based on the employee's symptoms, they're subject to quarantine. That is absolutely acceptable documentation and is required under the Families First Coronavirus Response Act to entitle the employee to leave. So there does not need to be a positive test to entitle the employee to leave. So that type of medical documentation is not only acceptable, but very much appropriate during this time. Going back to the required notifications, those employees who are in the vicinity of the infected employee, certainly for risk management purposes and for compliance with the Department of Health's order, really should be notified that there was someone in their vicinity who was manifesting symptoms. So an example of a risk management concern, let's say someone who worked in that person's vicinity starts having shortness of breath. They start experiencing symptoms. If you wouldn't have notified them that someone in their workplace had COVID-19, they might think, oh, well, this is just allergies, and ignore it, not get medical attention. Then they get very sick at some point, or God forbid, pass away. Then you as the employer have massive workers' compensation liability and even possible survivor actions on behalf of the family. So it's critical to notify, for risk management reasons, those in the vicinity. If you work in a large plant, or you have many employees, there really isn't a need to notify each and every person in the workplace. But just as to those individuals in that employee's workspace, it is crucial to notify customers and clients. Generally speaking, no reason to notify, probably shouldn't. The only exception I can think of is perhaps if you're a service provider that provides close, upfront, one-on-one service with employees. There could be a circumstance where, for risk management reasons, you want to notify those particular customers or clients. But generally speaking, no reason to notify customers or clients, and probably not a great idea. Who you really should notify are those employees in the vicinity of that worker.
Okay. This one states, okay, so I'll just read this. It sounds like everyone who's not providing family care / forced quarantine or not at high risk are just insubordinate. What if they live with a high risk, immunocompromised individual? Aren't there some additional concerns?
Yes, and thank you for the question, because it sounds like perhaps there was somehow a misunderstanding of the recommendation. So my recommendation in looking at employees who are resisting coming into work is to separate them into 3 categories. First category, which I have spoken to frequently, is when they have a legally protected right to leave, which actually could include if they have a quarantine family member. If an individual has a quarantine family member, you'd want to speak with your legal counsel, your labor counsel, because they probably do have a legally protected right to leave under the Families First Coronavirus Response Act. Second category, high-risk employees. These would be employees who have a pre-existing condition, they're elderly, for some reason their physician believes that they're at a higher risk. This category of individuals, I encourage not to view as insubordinate, and I encourage to approach with caution so that you as the employer can manage other critical areas of legal risk, such as workers' compensation, survivor actions, OSHA standards, the Department of Health order, etc. So this second category of employees, I'm not encouraging you to write them off as insubordinate. The advice was to approach them with caution and to make a wise risk management decision in light of all of the various areas of risk. However, the second category isn't necessarily legally protected to leave. They would just be individuals who you might grant leave to for other reasons, for other risk management reasons. The third category is the category who you could view as insubordinate. These would be the employees who do not have a quarantine family member at home. They do not have a high risk for some reason. They do not have a pre-existing condition. They just simply are resisting coming into the workplace, either based on the worry well, as Dr. Pelosi pointed out in his presentation, or some other type of more unfounded belief that isn't really supported. So I am not the advice. I don't think any lawyer's been giving the advice to just write off people. And in fact, the presentation spoke to the normal risk management concerns being turned on their head, meaning typically we wouldn't encourage you to be more liberal with absenteeism policies. Now, we as legal community have been encouraging employers to look at circumstances individually and to always approach with caution when you have an employee who is resisting coming into work. The 3 categories are just a general recommendation. It is always better to speak with legal counsel, your own company's legal counsel, if you have any doubts. So thank you very much for the question. That's something important to clarify.
I had a medical one next, but I think this one sort of builds off what you just stated. So let me hit this one first. It says, if we have work available and the employee declines to come in, is it proper to say, okay, however, we will need to report to UC, I assume unemployment compensation, that work was available and the employee declined to come into work? And it does clarify that due to the CARES Act, they see the extra $600 as bonus to not come to work.
Yes, 100% agree with the question. So if you as the employer furloughed a number of employees and now either have work available or have funds through maybe the Paycheck Protection Act or some other way to bring them back into the fold of the workplace as opposed to unemployment compensation, that individual must come back at the risk of losing the unemployment compensation. And actually, I believe it's 7 days. It's a pretty quick turnaround time that the employer has. I believe 7 calendar days, but that's something that that you might want to check. But in any event, there's a specific form actually that's provided by the Pennsylvania Unemployment Compensation Office with the Department of Labor that you can use to report that. And actually, as an employer, you need to report that if an employee has refused acceptable work. And this has nothing to do with the 3 categories I just mentioned. Let's say you bring someone back from furlough and they say, I have a Families First Coronavirus Response Act reason to be on leave. That's perfectly fine. Unemployment does not pay for that, though. That is not through the unemployment system. You bring them back from the furlough, and then you as the employer can offer them leave under the Families First Coronavirus Response Act, which for most employers would give you a tax credit. Again, that's another thing to check with your legal counsel about. There's some nuances there. But yes, no matter what the reason, doesn't matter what the reason is. If it's that they are sick and they can't come in, you as the employer would deal with that. If unemployment time is over, they have a job, they're either back or they are, or you're contacting the Department of Labor. They're no longer entitled to unemployment. That's a legal requirement.
And I would just add to that, a couple weeks ago, I attended the Pennsylvania State Chamber of Commerce had a long Q&A session, and unemployment compensation was on it. A gentleman from there. This question came up, and the actual word they used was fraud. It is
100%
insurance.
agree. Yep,
It is
100%
insurance
agree.
fraud.
Yes, yes. And if you as the employer do not report that, then you would be cooperating with that. So Scott, that's a great point, and I 100% agree with that. That is fraud. If their job is open, they must come back, and if they don't, you as the employer must report it. It's fraud not to.
Okay, this one's a medical question. Does the medical community consider associates and spouses who are pregnant to be in the higher risk category? And on that, should provisions be made to keep them out of work as a means to minimize that risk and exposure?
That's a great question. Initially we were considering pregnant women to be possibly at risk for complications. Now, pregnant women from a medical aspect are not considered to have a medical condition and ailment, but it does make them more susceptible to certain situations, especially if they're considered a high-risk pregnancy. So from a medical perspective, there's no clear reason to restrict them from circumstances such as a workplace with COVID-19, but there may be reasons why their obstetrician may wish to restrict them if they're high risk. So once again, I would not challenge the situation if they were to be excluded from a workplace situation. But overall, what we've seen actually is that pregnant women have fared no worse in many situations, as long as it's not a high-risk pregnancy, than others. And I've seen some returning to work who have come down with COVID-19 who have done rather well. And I've seen people who aren't pregnant not do so well. So that in and of itself is not a medical specific restriction. However, in individual cases, it can be, which would be really important for their healthcare provider to weigh in on what they feel the risk would be for them to be in the workplace.
Okay. We are real close to the end. One's slipped in here for the Family First Act. It states Family First Act and expanded leave reasons only affect employees under 500. I'm sorry, employers under 500 employees. That hasn't changed, has it?
No, it has not changed. It's actually kind of the opposite of the FMLA, which affects only employers with over 50 or more employees. The Families First Coronavirus Response Act actually puts a kind of a ceiling as opposed to a floor, if that makes any sense. So no, that hasn't changed. And for those of you who have never heard of the Families First Coronavirus Response Act or think there might be some nuance in how it applies to your organization, you really should contact your own labor council. That the Families First Coronavirus Response Act is something, the regulations are something like over 50 pages long. So there's no way that I could have covered every nuance in a presentation that wasn't specifically focused. There's also an exemption for smaller businesses as well. So for those of you who are sitting here wondering if it applies to you, please contact your own legal counsel for that determination. I am speaking more generally to the general Lehigh Valley employer that probably would fall within the Families First Coronavirus Response Act as a qualifying employer.
A question came in, and it was actually part of the previous question. It said, "What about an employee who is scheduled to have surgery in a hospital?" And
legally speaking, the employee with a scheduled surgery would tend to fall under the general FMLA protections. Under the FMLA more generally, a scheduled surgery would generally fall under one of the reasons that an employee can be qualified for leave under the FMLA more generally. Also, your regular PTO policy would apply in that case. That's not a just general surgery would in most cases not fall under the Families First Coronavirus Response Act.
Okay, and I think it was I think it was also in the context of additional at risk. You know, are they considered additionally at risk when it comes to come back to work if they have a scheduled surgery?
Are
I
we
would
talking
defer
about,
to Dr. Pelosi on that.
are we talking about medical risk? Is it a risk to return to work if a person has a scheduled surgery? Is that the question?
Correct.
I don't believe that it's at any greater risk than anything else that the person might be doing. Remember, people are still allowed to, even at the stay at home, a requirement to go take care of essential functions. If they're working in life-sustaining businesses or essential businesses, we're not restricting people who have to have a surgery, and we're not restricting people from having surgery if there's traumatic injuries also. As you know, that there's been a lifting of the elective surgery stay action by the state, and elective surgeries have been conducted, and all the while people have been attending work at life-sustaining businesses. Attending work when expecting surgery at this point is not a restriction. As long as you're obviously implementing risk decreasing strategies, I don't see that as an issue currently.
Okay, and then one more build out on that one. The question is, if they contract, you know, what would be the implication if they contract COVID within the hospital? I do want to just mention on that one, because this has come up in a previous meeting on when people asked about workers' comp, and the tricky slippery slope in general is identifying where the person got the COVID. You know, you can get it at the grocery store, and you know, for it to be workers' comp, it becomes well, how do you prove you got it at work, as opposed to when you went and did a Target run. So that aside, the question is again, what if they contract COVID while in the hospital, and how does that impact what we're talking about?
I mean, I'm not sure if that's a legal or a medical question. From the legal perspective, it doesn't matter where they've contracted COVID-19. They would still be entitled to legally protected leave to the extent that they have leave time available under the Families First Coronavirus Response Act. One interesting piece of nuance on that question is, how do we respond under the FMLA, Family Medical Leave Act? There are plenty of employers out there, clients I work with, who have employees approach them who have already exhausted their FMLA. So if I'm assuming, for the sake of your question, whoever asked that, it's a good question, that you have an employee who's already taken their 12 weeks of FMLA leave while they were in the hospital for the surgery, and now they've contracted COVID-19 and they want to take additional leave time. Under the Families First Coronavirus Response Act, the leave time would be that 2-week or 80 hours of paid emergency leave. So even if they could establish that they have a serious health condition with their COVID-19 diagnosis, because their FMLA was already exhausted, we would just have the 80 hours or 2 weeks of paid emergency leave that the employee might be legally entitled to.
Okay, thank you.
Scott, an interesting twist, if I can interject, an interesting twist on that question would be if there was a workplace injury covered under workers' comp and the person required surgery and went into a hospital and then acquired COVID-19 while there for surgery due to workers' comp injury. And, you know, I would make a case to say that the workers' comp was the COVID-19 infection might have been a complication related to the need for treatment for the workers' comp injury. And I'd like to ask Keely if she has any comment on that, but wouldn't that be covered then under workers' comp regulation?
Yes, it certainly could be. That's an interesting point. If the employee was at the hospital due to a work-related injury and contracted COVID-19 at the hospital, I think that a savvy plaintiff's attorney could probably make a pretty good case that the injury would fall under workers' comp law. I'm not sure whether or not that connection would be ultimately sustainable, but certainly the case could be made.
Okay. There's one more specific question, and then there was I think a general more of opinion question, and I think we're going to just cut it off at there because we are coming up on 2.5 hours, and this has been great conversation and obviously much needed, but we'll be able to kind of follow up by email and do additional conversation, and we'll let the people still around go. The specific question, easy for me to say, is can a company ask a subcontractor working on their site to provide names and temperature checks emailed to them daily?
You can require pretty much anything you want within certain limits from an independent contractor. This would be an outside agency that's contracting with your organization, provided that that requirement is agreeable to them and doesn't violate any of the requirements under the pre-existing contract. You can do so. However, before you do that, I would encourage you to stop and think about the reason why. Why are you requesting temperatures of every single employee of the contractor? And also, two, please in your requirements there, consider the potential risk that you're taking on. Generally speaking, it's the contractor's obligation to manage its employees and to determine whether its employees are able and acceptable to return to work or enter the workplace. If you, as the employer contracting with the third party, start taking on that obligation yourself of monitoring the contractor's employees and determining whether, in your opinion, the contractor's employees can enter your workplace, that could be considered a joint employer situation, which might open your organization up to liability. So we're back to the general conundrum of the legal profession, and that is balancing all the competing risks. So on one hand, I think that the rationale behind that requirement might be positive in the sense that you as the employer want to make sure that everyone who's entering your workplace is acceptable under your standards to interact with your customers, clients, and employees. But then on the other hand, it's important to also think of the risk management concerns in other areas, such as potential joint employer liability in entering into a space where you're actually managing, directing, controlling, receiving medical information from a contractor's employees. So I would approach that with caution and consider both sides of the issue. So yes, legally, the bottom line answer is yes, legally speaking, you may. However, for risk management purposes, you might want to stop and think before doing that about how you might encounter potential joint employer liability or other forms of liability by getting into a management situation with a third party's employees.
Okay, and then the last question is, and I like you both, we'll end with this to take a minute or two on what you feel. The question is, do you feel that these changes will be permanent, or will we ever go back to enforcing, employees to work, etc.?
Is that for both of us?
Yeah, if you could just give a comment. Again, the question is, do you feel these changes, any of these changes will be permanent, or will we go back to the way things were?
Well, first of all, I would just, oh, no, go ahead. You go ahead, Dr. Pelosi.
Oh, okay, because my answer might be more simple. I believe that there's been great advances in telemedicine, telehealth. I think that there will be ways that we do things now that are different in a workers' comp environment than we've done before, such as implementing more televisits. I think sanitation in the workplace might be a great, or maybe if there's any positive to this, that may lead to less disease absence or less presenteeism due to infectious conditions. Because remember, we're dealing with COVID-19 right now, but there's a significant amount of absenteeism and presenteeism due to influenza and other infectious diseases every year. I would like to see one of the results of the workplace be that we sanitize more, hand sanitation, precautions, and so forth, which might lead towards a more productive and healthy work environment. And So I would like to think that one of the things that will continue would be positive aspects that come out of this that lead to a better workplace.
Attorney Collins?
Well, first of all, I would just like to again reiterate what an honor it is to be here today with LVHN. Dr. Pelosi and the physicians who are working on the front lines with COVID-19 are truly our heroes. I appreciate everything that he and LVHN have been doing for us, putting themselves into harm's way for our health. So it's truly my honor to be here today to talk with Dr. Pelosi and all of you. And I hope you were able to get something of value. In terms of how I would predict the workforce will move forward is with a new understanding of the importance of health in the workplace. Yes, absolutely. We will return to a time when our workplaces are open and functioning as more active going concerns with our public. And we will return to a time where employees are able to come into the workplace and perform their jobs in person. However, that being said, many employers through COVID-19 have learned what has been a positive lesson, and that is the ability to work remotely, which is giving employers the ability to not only reduce costs, but to create a more manageable workplace for employees who might have a preference for working remotely, and also for employees with health concerns that make a more remote workplace a better environment for them. So moving forward from a legal perspective, I could see the workplace landscape becoming more health conscious and more remote in nature, very similar to how after the September 11th attacks, airports became much more conscious in a way that, although perhaps irritating to some, passengers, has in a way enhanced our safety and security. So I agree with Dr. Pelosi. I think the outcome will ultimately be positive in encouraging health and safety in the workplace. Thank you so much for your time and attention. You've sat with us for a long time, and I realize right now your time is valuable. You have a lot going on. I appreciate your time and attention and spending it here today with us. And if you have any other questions, please do not hesitate to reach out to me by email.
Thank you. And the same goes for, okay.
Just saying, I thank everyone. I would like to especially thank Attorney Collins. She has been a great asset to the business community, and we've always really enjoyed her education and her knowledge on these topics. So thank you, Attorney Collins, also.
And as a final, thank you for those who stood out, but there will be some emails around this. We call this the next phase series, if you will. There will be another presentation on Tuesday. You're going to get an invite a little later today for that. That is going to be looking at your employees specifically and their well-being, how to support them and help them, because stress for many reasons is at an all-time high. So we'll be having people from both the physical and mental health sides of well-being, sharing some outlook on what your employees might be going through and what you as an organization can do to help them. So you'll be getting an email on that, and you'll be getting an email with the presentation and a link and a survey. So thank you all, and have a great rest of your day. Bye.